you, Darrell?
I'm well. It's good to see you, Kimberly.
It's so good to see you. I have to say, I always enjoy chatting with you, probably because I feel like a cousin. You're down in Utah and I'm up here in Idaho. So we're practically related, right?
That's right. Very uncommon to have a conversation with people anymore that are that close.
All right. That's so true. I didn't go to BYU. My oldest boy went to BYU. So I think, oh my gosh, he's my guy.
Seriously.
So, well,
Did he
I'm just, oh, go ahead.
did he enjoy it?
Yes, of course.
Did he?
Yep, yep. He went to the nursing school there, and
Well,
yeah.
he following in his mom's footsteps?
Ah, I tell you, making me proud. Yeah, we come from a long line, backward and forward of nurses.
It's great.
So yeah,
I have a daughter that's a nurse.
ah, and you yourself, I understand you ran as a hospital administrator. You ran 10 different
I did.
hospitals, healthcare organizations,
I did.
correct? Yeah, so. That's really fun when I talk to folks who've been on that side of the fence because um you have an insider view, so to speak, that many people don't get to really see. Even people that work in hospitals
Correct.
don't often get to see that side of healthcare. And I think it's really cool how you took that experience, you left that side of healthcare, and since the late 90s here, you've been really focusing hard and charging hard on prevention. And I think prevention gets a lot of lip service and very little, it sounds really good, and everybody's changing their hospitals names from hospital to health, right? And yet we see very little actually carried through in the realm of truly getting upstream from some of these chronic and high cost conditions. And I understand that's what you've been doing for a long time, focusing on behavior change and real population health, and what you're doing with the Nuka tribe up there with your aspirational health model. Um, that whole movement, I think, is really exciting, and I think our nation and our industry is really hungry for an aspirational healthcare model. So I'm really happy to share some time with you, and if you wouldn't mind, just as we start off here, maybe you could share a little bit about what was it that brought you to this place in your career, and what does that mean, an aspirational healthcare system, health model? What does that look like for you?
So, like you mentioned, I had the privilege of being either the administrator or the controller CFO of 10 different hospitals. And it did give me a lot of insight into the business of hospitals.
Yeah.
In fact, most of those hospitals were for the largest hospital system, HCA. And I have nothing to bash against any of the systems, particularly HCA, well-run company, but I was helping hospitals implement Edwards Deming's principles of continuous quality improvement. Because back in the early or late 80s and early 90s, Joint Commission, which is the organization that all healthcare facilities bow to. It's like if you're not Joint Commission
Yep.
accredited, you can't bill an insurance company, you can't bill the government through Medicare, Medicaid. So everyone really bows to Joint Commission,
Yep.
as well as we did. And Joint Commission came out with this new philosophy of how to survey hospitals. And to put it simply, if I were going in and inspecting a bakery, the old way the Joint Commission did things was let's check to make sure that the oven can get up to the right temperature. Let's check all the recipes to make sure that they look right. Let's make sure that all the recipes got approved by the head baker. Let's make sure that the refrigerator is reaching the right temperature. Let's make sure there's no bad food in the refrigerator. But they never would taste the bread. And so
Yeah.
Edwards Deming's principles of continuous quality improvement say four things. Who's the customer? What's going to delight the customer? What are the processes that you need to be monitoring to most measure how well you're delighting the customer? And then when you find variance in those monitors, get the people closest to the process to improve the process so you go take out the variance. Well, I was very passionate about those principles. And so I was helping hospitals as I went from hospital to hospital to become accredited with a commendation, which is kind of the highest level of Joint Commission accreditation by implementing these new principles. So I was very much caught up in this idea of implementing joint or the Edwards Deming principles.
And
Well,
not just passing
they're
inspection,
really
but
trained, yeah, but to get the
yeah,
highest level. So I was very much involved in building these teams where we would identify these improvement opportunities and we would work together to improve the process and we would measure and monitor, see if we're making a difference. But it was very difficult not to step back and look at the entire healthcare industry through those same lenses and ask the very first question, which was, who's the customer? And I think that's one of the biggest mistakes that most healthcare people miss. If you really step back and say, well, who's the customer of the healthcare industry? Not the people served, but the
right?
customer.
Who's standing in the checkout line, getting the card out of their wallet to pay for
Exactly.
the,
Exactly. And
yeah,
that's generally two organizations, employers who offer benefits and Uncle Sam who pays for Medicare and Medicaid, which is really a representation of you and me, the public.
yep.
We're not going to get into a political conversation today, but let's take the majority, which are employers. And I couldn't help but think to myself, all right, if I define my customer as the business leader who buys healthcare benefits for their employee, what's going to delight that customer? Which is the very first question.
Hmm.
And I thought to myself, I literally get away every day scheming against my customer. I not only am focused on meeting their needs and delighting them, I'm actually getting away every day at working against them. You tell me one
Yeah.
CEO who buys healthcare benefits who wants me, the hospital administrator, to spend all my time, literally all my incentives, all my efforts to fill up my hospital bed. Because that's what I'm recognized for. If I have a full census, I'm a successful hospital administrator. If I
So keep
don't,
them sick, boys.
it's about keeping the hospital full.
Yep.
And I couldn't help but think, how does that happen? How do you get an industry, largest industry in America, in fact, it's the fourth largest economy in the world. How do you, how does it nobody's holding us accountable? And when you really look at the distance between me, the one running the hospital where most of the money's spent, and the CEO who's willing to pay for healthcare benefits, there is such a huge distance between those.
Yeah.
Hence, the effort on my side to try to meet that person, that customer's needs, it's not there. There's nothing about running a hospital that's focused on really working for the real customer who pays the money. And eventually, as that became very clear in my mind, I said, I can no longer be on the treatment side. And I'm not saying anything bad about the people who are. That's not where I want to try to put my next 20 years of my career. So I left the treatment side to see if I couldn't get this lack of accountability fixed. And how, if we really are going to try to meet the CEO's needs, shouldn't we be working to accomplish their goals? Because getting to visit with a lot of CEOs across the country and have for the last 12 years, it's one of the things I enjoy most is getting in front of a group of CEOs and asking them questions. Why do you buy all these benefits? What do you want? I always hear them tell me, well, first of all, I don't feel like the customer. But if I
Yeah.
did, and you really wanted me to tell you what I want, I would have to tell you that I want to attract and maintain top talent.
Yep.
That's why I pay benefits. Number one reason. Doesn't matter where I go, who I talk to, that's the number one reason. I offer health benefits because I want to attract and maintain good talent. But if you really push me, I also want that talent to be healthy and productive.
Yep.
Because the more healthy and productive they are, the better they serve my customers. And third, I want my employees to feel like I'm giving them the best. I want them to feel like the healthcare system that I'm offering them is the best possible so that they really feel like I'm taking good care of them. And then fourth, I wish it didn't cost much. I wish it was more affordable. Well, there's no hospital administrator out there that I know of who spends any time focusing on how do I meet that customer's needs and how do I measure how well I'm meeting it. In fact, if you look at the entire healthcare industry, from
Yeah.
HR who buy healthcare from brokers to insurance companies to all the providers. Nobody in that entire ecosystem is working to meet the customer's needs. And therein lies the problem. And that's what I've been focused on for the last almost 30 years is how do you meet that customer's needs? Because once we get that customer to hold the system accountable, the whole system will change.
Yeah.
It'll start to work for the customer. But until that customer wakes up and says, I think I should expect something for all this money I'm spending. And this
Which
is what
is,
I
well, which is one of your points. And we've talked about that earlier, when you look at, with your new book that you've got coming out, which is awesome, by the way. It comes out, just in a few
want.
days, February 4th,
Yep.
right? Um, and we were talking about this. I'm trying to make healthcare work for you. And in there, when we were talking earlier, we're talking about, I mean, your main reader for this book is going to be CEOs. And we talked about, well, why? I mean, and right there, you answered why is the CEO who really, why is it the CEO that's the person who really needs this information? And I would say, and we talked also about because, for many CEOs, they didn't start, as as you're a CEO yourself, as a CEO, most CEOs don't go into business to work in healthcare. And yet, when I talk to CEOs, they tell me, I did not get into business to do this crap, and yet I have to know benefits. And so they're really vulnerable. They're a vulnerable consumer.
Yep.
As a nurse, my vulnerable consumer is a patient. And in the architecture of healthcare benefits, the vulnerable patient is the CEO, and his provider, if you will, is usually a broker.
Uh-huh.
And the broker is really the person who needs to help make sure, just like a nurse or a doctor is going to make sure that the patient, the member, has access to and has understanding of all the information they need so they can make the decisions that are best for them. And likewise, the broker in a similar fashion. Savvy broker, we like to call them advisors, right? Fee for so they get paid for their work of advising, not, wheeling and dealing, stuffing money in their pocket, but
Well,
for
and to the point, I love to ask CEOs if this is what you want, who are you rewarding when you get it? Like, this is
uh-huh.
what I want. Am I measuring to see if I'm getting it? And who am I incentivizing to
Hmm.
help me get it? Well, they never hold HR accountable to bring those things.
Right.
Hence, HR is in this middleman role, and there's like nobody ever got fired for hiring IBM. So as long as I hire the big name brokers,
Yeah.
a great reputation, then I'm going to be fine. And it doesn't matter what happens, whether my boss is getting what they want or not, I'm going to be okay. Well, what
Yeah.
people miss is that most brokers across the country make more money when healthcare costs go up. And they don't like to have to bear the bad news every year to come out and say, hey, you're getting another 15% increase
But
and
that
God,
means more money in their pocket.
but they're making more money when that happens. One of my
Yep.
very good friends who's a broker many years ago taught me that there's a phrase in the broker community that they kind of keep to themselves, which is trend is our friend.
Yeah.
And if healthcare continues to trend up, that's good for all of us. And
Uh-huh.
and so and then from that point on, and some people think, well, it's the insurance companies who are trying to control costs because they want costs to come down because they get to make more money. And what they don't realize is just the opposite.
Yep.
Thanks to the Affordable Care Act, the only way insurance companies can make more money for their shareholders is for costs to go up. So
Yep.
insurance companies are in the business of projecting an increase and then being really good at hitting that increase. But the more that increase goes up every year, the more money they make and the more profit they give to their shareholders. So it's like,
And likewise, the employer can't keep covering more, and more of that cost gets shifted to the
boy,
member, the employee.
and now they can't attract and retain top talent like they want to. It's crazy.
And then
And
you
it
have an employee population that's sicker and sicker because they're not going to go get the health care they need
right.
because it costs too much.
So the message to CEOs that's in the book is simple. Someone has cracked the nut. A major organization has proven that there's a better way to do healthcare, and it's called aspirational healthcare. And second of all, it's easy to implement for your employees. And it will bring your employees higher satisfaction, better health outcomes, and be a much better healthcare system to meet their needs. It's like that's all the CEOs need to be able to go, well, I want that. And CEOs don't need to know how to put it together. All they need to know is they can expect more. That's
Oh, and
all
we
they
do.
know
We all
is
get what
that
we
they can expect
expect.
more. Exactly.
Yep.
Right now, CEOs, they're like, if Warren Buffett and Jeff Bezos, who created Haven Healthcare and Diamond,
Yep.
to put their weight behind changing healthcare, can't fix healthcare, then why am I worrying about it? I'm not as big as Warren Buffett. I can't do anything
Yep.
about it. I gotta focus on making more money. And if it means I got to keep focusing and focusing on making more money so I can pay for these increases, that's what all I know. I don't know how to do it. And nobody else does either. All they need to hear is yes, it's been proven by a major organization. The South Central Foundation's NUCA system of care has proven that an aspirational model is half as expensive, has better outcomes, internationally and nationally recognized, and it's not hard for you, the employer, to expect that you get that
Yes.
kind of health care. That's the message of the book.
And learn how to demand it. And I love this. Some of your stats from the NUCA system, 97% customer satisfaction, who has ratings like that?
Yeah.
63% decrease in hospitalizations, who wouldn't want to have that? And 50%
Hospital
reduction,
administrators wouldn't want to have that.
right? Absolutely. 50% reduced cost compared to, the out of the box traditional US healthcare model. What would you do? I mean, as a CEO, what would you do with 50% more money in your pocket? What could you do?
With happier employees
Yeah.
and employees who want to stay with you longer and easier to attract employees. It's like if you were saving 50%, imagine how you could offer healthcare at no cost, no
Yeah.
copays, no deductibles, no premiums. It's like, what's wrong with that?
And who's going to leave that?
Exactly.
Who's going to leave that?
That'll be
Yeah.
a
And
retention.
then year over year savings, gosh, what could you reinvest in your business in terms of growth and development? I just think that's awesome. So, you brought up something earlier, that continuous quality improvement model that you talked about. And I think that's really important because you can expect something, but unless you know how to break that down into measurable components, and we always say when we're talking to our folks, if you can track it, you can change it. You can't hard to change a target that you don't know is out there. All right. So I'll have people sometimes they'll say, well, I'd like to lose weight or I'd like to make more money. You give them a buck. Is that really what you want? You have to be able to measure. So, you know, one of the things that you talk about
Not
is
hard to measure. It's not hard to measure the number one thing that employers want. Think about it. If what I want is for my employees, I want to better attract and retain them. Well, think about it. How hard would it be to measure how well your healthcare benefits helped attract your employees to come to work for you? It's a survey. Just ask them, how important were my benefits when you came to work here at taking the job? That's an easy question to ask, right? And then the next question, which is something you want to keep asking on a regular basis, is how well are my benefits working at keeping you here? That's an easy question. And now you've got the number one most important monitor that you're building your entire reason for buying healthcare. Now you can evaluate whether it's working. And now you can start holding the system accountable. And if it's not working, then you need to hold the people who are responsible for buying it accountable to meet your requirements. It's that simple.
and if they don't want to play along, you need to find somebody who will, because there are plenty of people out there who will play that game with you
Yep. If
with
my
vim and vigor.
isn't as high as the NUCA system of cares, then you tell me why. Because I can expect it. If they can, in a most difficult environment, with one of the most difficult population healths in the world, create a
Right.
system that has the highest level of satisfaction, what's your problem? Why can't we get that for my employees? I want that. I should expect that. And if you
Yep.
can't get it, then give me somebody who can. And
Yeah.
let's make sure that your job, your incentives, your bonuses are based on making sure I get that. Now, to their credit, HR will go, well, what am I going to do? The big brokers aren't bringing me that. Nobody's told me about this before. I'm doing just what everybody else is doing. Then you just have to simply say, look, no, it is possible. Look, they've accomplished it. And you know what? Keep paying your broker more money for not giving me what we want is not going to work for me. And if that broker is not going to start working for us, Let's fire them and find somebody who is. Because that broker and their rewards and their bonuses and their increases should be all based on me getting a system like the best healthcare system in the world. And the good news to the CEOs is that there are a number of brokers out there that'll do that.
Yep,
That's the good news
there
is they
are.
have to figure it out. In most cases, they have to fire their current broker because
Yeah,
to convert your current broker, they're not going to know how to do it. They're
they
not
can
going
still
to know.
golf with them, but get them off their payroll.
Exactly.
All right. Absolutely. We do get what well, and I think, like you and I were talking before, I think it's hard, and it's hard for, I think, CEOs to wrap their head around, what do I have to do? How do I find this person? And I think, as they read your book, it's just like anything else. Once you know something is better out there, why not? Why can't you get it? And I think one of the factors that's going to move people is that we're heading into an environment where if a CEO doesn't, chances are it's a matter of time before an employee will. We're seeing lawsuits tick up. The employers, they do have a fiduciary responsibility
They
to
do.
make these decisions wisely. And
It never felt like they do. They've never felt like
right,
their responsibility to offer a health plan that is more cost effective or creates better outcomes. It's like as long as I'm working with the big brokers and I'm
they're
working with
supposed to do
the
all that for me. Well, they
that's
don't have the fiduciary responsibilities that they
no, you
do.
do. You do. And as soon as these big Johnson and Johnson's being sued with a class action lawsuit, there are many others now. It's like I really think it, and unfortunately, I really think it'll be the legal risks
Yeah,
that people want to avoid that will wake up the CEOs and go, yeah, I don't want to be on the clock because that lawsuit is coming after my personal property. And my
yeah,
current liability insurance policy isn't covering that
no.
for me to be a fiduciary. And so just wake up, define
And it
what you
will happen because employees can no longer have access. They don't have access to the care that they need. And it really feels like their hands are being pushed. They're being pushed. They will
yeah.
do this, and there are plenty of lawyers out there that are talking to folks.
Oh, they're
Um,
recruiting crazy.
they
Yeah.
are absolutely.
Well, and it made a big difference in the pension world.
It
It
did. Yep.
completely transitioned the pension. We went from pensions to 401ks because
Yep.
CEOs did not want to have the fiduciary obligation of worrying about making good investments with those pension funds. So let's just give everybody a 401k and let them decide. The same pressures
Yep.
have the similar impact on the healthcare system, and CEOs will start expecting more.
Yep. It would behoove us to learn lessons from their skin knees than skinning our own, wouldn't you say?
Yep.
Yeah.
Well, let's
Yeah.
talk a little bit about what is aspirational healthcare.
Yeah.
Because
That'd be
all
great.
we talked about is, well, there's a group in Alaska, 70,000 Alaska Native people have created the best healthcare system in the world. Countries from all over the world go to Alaska to learn how to do it. Now, this country is starting to wake up, and major employers, like the biggest employers in the country, are rolling out a NUCA style healthcare plan for their employees. They're not forcing them into it, but they're giving them the option. So let's talk about what it is. What does it mean for me to have an aspirational model of healthcare? Well, in healthcare, so often we think that healthcare is to fix me when I fall off the cliff. So we build hospitals at the bottom of the cliff. So
Yep.
we can fix people, and the more people that fall off the cliff, the more money we get to make. That's how healthcare works.
Yep.
So we have a very sick care system, and it's very sick care treatment oriented. Well, imagine having healthcare be a partner with you on your path of life, helping you from falling off the cliff in the first place, and even more importantly, there to support you in reaching your destination on that path. Imagine a healthcare system that was built like
Oh.
that. And
But where's
that's
the money in that, Darrell? Come on.
Well, it's not for the hospital that builds at the bottom of the cliff because there's not going to be as many people falling off. The money is where the money should be, which is in the pocket of the customer who's paying for it.
Yep.
And when you pay for a healthcare system, the journey now you might say, well, that's a great metaphor, but what does that mean? Well, the first thing is let's talk about the front door to healthcare. What this group in Alaska did, this amazing best in class healthcare system in the world, was they started off by doing what Deming always asks everyone to do. They asked their customer what they wanted. They wanted to know what their 70,000 people that they were going to be providing healthcare for wanted. And what they heard was, we don't want a paternalistic system that tells us what to do and
Yep.
simply fixes us when we fall off the cliff. What we really want is a healthcare system that partners with us on our path of life, supporting us in reaching our life's dreams, goals, and aspirations. So, this incredible group, and I want to just a shout out to these Alaskan Native tribes, 190 different tribes across Alaska, who think of things from the eighth generation perspective. They don't make decisions based on what's going to be good for me tomorrow. They look at the decisions that they make in terms of what's the great, 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 great grandkids going to do? How is this going
Yep.
to affect them? So they took that concept of what the customer wanted and they architected a very different healthcare model and has now been proven. They quickly went from the worst healthcare population and the worst healthcare system over 25 years to now being the best healthcare system in the world. And the improvement in their population health has increased by like no one else in the world, which is why they get so much acclaim.
Yep.
It's like, how did you do that on half the cost?
Yep.
Well, they changed the front door. It's like, if you consume healthcare through a front door, through a primary care provider, then why don't we build what they call a massively powerful, relationship based, behavioral focused, customer centric primary care system?
Be still my heart.
Imagine if your dad was the doctor. What would you do every time something came up? You would ask your dad, right? Well, what they said was, that's our goal. Let's create a healthcare system where the relationship we have with every member is just like calling your dad. So they took that primary care team and they built more. It wasn't just built around one person. They took a provider, a physician or a nurse practitioner. They took a nurse case manager. They took a medical assistant and a support person. They said, look, you are the team for these 700, 800,000 members. And in many cases, we're going to have you assigned by family and by tribe and by community. So you're the team for that group. And they can
Yep.
change anything they want, but now your goal, your first primary goal, is not to be a doctor. And it's not to be a nurse. And it's not to be a medical assistant. Your first and most important job is to get in relationship with each member of your population and build a trusting relationship and be their support, be their confidant, be the person that walks alongside them to help them reach their goals in life. That is your first job. And now, because you've built a relationship like you're their dad, and they trust you like their dad, and they have any kind of a need, and you're there on an ongoing basis, proactively supporting them to be healthy, if they fall off the cliff, if they fall down and break their leg,
You're the first
they
person they think of.
And this is the
Yep.
doctor's office. This is the hospital. This is the new healthcare system. I just pick up the phone and I text or call my friend, my dad,
Yep.
my doctor. And if he's not on call, one of the four is going to be
One of
on call.
my team.
One of my team's available,
Yep.
and they have made the
Who already
commitment.
knows me. They know my story. They know my community and the challenges that we're all facing.
Exactly. And
Yep.
their commitment from the very beginning has been that each member of our community has immediate access to care, same day, perfect care every time. So you're not only there to be their friend, to support them, but you're also available so that when something does happen, you
Yep.
don't make an appointment for 3 days down the road where you have to take off at work and you have to come in and see the doctor. You literally have
Or you have
access
to go be seen in
immediately.
the ER because nobody can see you.
Right. And 70% of everything that happens in primary care can happen over the phone.
Yep.
It doesn't need, the only reason we build a healthcare model that's a sick care model around you come in and wait in, you take time off work, you make an appointment, which you'll work around my schedule, the doctor.
Yep.
You'll sit in my waiting area area for who knows how long with everybody else that's sick. You'll come into my office, you'll get measured by a nurse or a medical assistant. And then after the nurse and everybody's taken then I'll come in and I'll spend 5 minutes with you. I'll diagnose you and I'll give you either a referral to a specialist or a prescription. And that's all the time I have because I'm being held accountable as
Yep.
the doctor to the healthcare system that owns me to make sure I see 30 or 40 patients every day.
To
And so
produce.
I to produce. And
Yep.
so they built a healthcare system that was like, no, I'm available. I don't have as many patients in my practice. I'm there to help you. I'm there to respond to you. If you do need to come in and see me, we're going to spend as long as it takes. If it means hours, then that's fine. Well, anybody that's a CEO listening to this and go, well, that's all nice. I don't have the time to go change healthcare to do that. Well, they don't have to. The good news is there are already primary care practices that work that way. The
Yes,
problem
there
is
are.
in they're not in the provider network that you're
Yep.
handing out when you hand out the insurance policy. They're not in the Blue Cross, the Aetna, the
They're not
Cigna
in the
network,
network.
those networks. And so as long as all you do is offer a benefit plan that has a network of providers and your people have to go find the network provider that will see them, well, it's like feeding them to the dragon because now you're doing is you're sending them to providers who are owned by the healthcare system who are going to be a funnel source up into the hospital. Well, as an employer, it's not hard to say, I'm going to open up my benefit and I'm going to offer my employees access to, and there are thousands of them across the country, and it's not hard to make an access to. And you just simply say, I'm willing to pay for you to have a whole different experience with the front door to healthcare. And that's what the jumbo employers are rolling out right now. Pitney Bowes, Ernst and Young, Lindy, Prudential Financial, and many others are saying to their employees, here's an option that I will pay at 100%. And now you have access to a whole different front door. And that front door isn't owned by the healthcare system. And they're going to make sure you get referrals into the 7,000 five-star rated surgery on your knee instead of referred into the three-star
Who paid to
$70,000.
play in the network.
Exactly. It's
Yep.
like we're going to make sure you get to the best where it's the best cost for you, best quality outcomes, best produced. And it's like the whole system all of a sudden changes because you're holding the system accountable to give you what you want. And it's not hard to put in place a system that offers a new front door.
Absolutely. I love that. And you talked about that. Stop feeding the dragon. Don't do it anymore.
And you don't
Um,
want to make your people change. You
yeah.
know, choice, relationship, and alignment are the three principles of this new model of healthcare, aspirational healthcare. Well, choice is a big one because you could be passing out tickets to heaven to your employees, and they're not going to like you because they don't want to change. So don't force them to change. Don't give them a message that they have to change their. I mean, you right now, every time 3 years go by, 2 years go by, you change your whole network because you want to save a few bucks. So you make everybody change their providers. Well, stop worrying about that. Just simply say, if you want to keep consuming healthcare like you always have, pay your copays, pay your deductibles, go to the network providers, you can. But I'm going to offer you a choice. Over here, you have the choice to consume healthcare in a whole different way, and I'll pay 100% of it. Now you choose. Do you want to keep paying copays and deductibles and go through the current system, or do you want to access healthcare through a better model? It's that simple.
Yeah, so true. Well, and the ripple effect of that model is so, we see it all the time here at Specialty Care Management, where we have the folks that usually end up in our wheelhouse in our CKD management program are folks that the reason why they get here is because they haven't taken care of themselves in the years prior. Haven't had my labs done in 3, 4 years. I can't afford to go in there and get my labs drawn. No, can't afford to go get my colonoscopy, whatever the case may be. They're not getting their yearly screenings. They're not, because why? I'm not going to pay for it until I'm broken.
Yep.
And you mentioned that before. You compared that to, if I took care of my car with regular maintenance, it's going to last longer. It's the
Same
same
with the body.
thing. Same
And
thing.
and because we don't think of healthcare as our partner, we think of
No.
healthcare as the place to go when we're sick. We don't even think about it. Now, take that for just a second and go back to what the CEO wants. Remember how the CEO wants to attract and retain top talent? That's their number one objective. Imagine offering a healthcare system to your employees that truly was their partner in life to help them reach the goals they aspire to. There's
Yeah.
a book called The Dream Manager. And I love the story of the book because that's what we want healthcare to look like. The Dream Manager is a fictitious story about a CEO who had lots of turnover. He said, I need to come up with a way to try to reduce this turnover. So he hired a guy who he called a dream manager. And he said, I'm hiring you for one purpose. All of my employees now have a person that I'm paying for whose goal it is to help them reach their personal dreams in life. Now, it took a while for people to kind of get accustomed to this idea, but literally, this CEO was saying, I want you to be successful in your family life, in your career life, in
Yes.
your financial goals, in your community goals, in your hobbies and dreams and aspirations. I want you to reach your bucket list. And I'm going to give you somebody who's there to support you so you can think about the bucket list and you can make plans to reach the bucket list and can help hold you accountable, support you in reaching that bucket list. That's what we're saying healthcare should look like.
Yeah.
Imagine offering a healthcare system that did that to support your employees to reach their dreams, goals, and aspirations in life. It's going to kill two birds with one stone. You're going to have
Yep.
amazing attraction and retention, and you're going to have amazing employees who love you for the fact that you're supporting it. And you're going to have a much less expensive healthcare system that their employees love as well. It's like, it's the best of both worlds.
It really does. And it ties your team to you. Uh,
Oh,
it
yeah.
really does.
Are they going
Yeah.
to get that where they go to some other place? Are they going to go
Yeah.
off and get a plan that's, one of your Blue Cross Aetna plans that just does what everybody else does? Or are they going to want to stay with you?
Yeah, you build this incredible esprit de corps, where people really dig in. And I always say that's why, our CEO, a lot of us, we'd march into the fire for him, just for that reason. Absolutely. I think it's powerful.
Which is
And
very important to CEOs. That's a
yeah.
culture to most CEOs is one of their top priorities. And what we're giving CEOs is an easy solution that addresses two of their biggest priorities.
Yeah.
Take
What a
care of
way
where,
to tell your people that you really care about them.
yeah, take care of your work
Absolutely.
ethic, buying healthcare, and create a culture where you're actually supporting their dreams and goals. I know a CEO who not only offers them a dream manager, someone to coach their people in reaching their dreams, he also pays them so much money every year to reach those. But you can't use the money on anything but your dream. So
Oh,
you're getting
wow.
someone that's supporting you to reach your dream, and you're getting money to help you reach your dream. Imagine the connectivity and retention that CEO is creating with his
Oh,
own employees
yeah.
because he's committed to them. There's another book that I love. It's called It's Your Ship. And many people have heard of that book. It's about the youngest admiral who took over the worst performing battleship in the Navy. And he simply implemented Edwards Deming principles of continuous quality improvement. And this concept that it's better to give more than you expect to receive back. And he simply met with every sailor and said, look, you're not going to be on this battleship for your whole career. Nobody stays on a battleship more than 3 or 4 years. So, what is your long term career goal? Do you want to be an engineer? Do you want to be a plumber? Do you want to be a carpenter? What is it you want to aspire to be when you leave the ship? Now, let's make sure that what you're assigned to do while you're on this ship is to help prepare you to accomplish that. He went from being the worst performing battleship in the Navy to being the best because
Yeah.
he was willing to give and expect to give more than he expected
Yes.
to receive. And that
Oh,
creates
yeah.
culture.
You tap into the fuel that creates that movement that we need to achieve. Yeah, that's really cool. And it's interesting as you're talking, I'm thinking about because you talk about four hacks, if you will, four secrets that you share in your book. One of them was feeding the dragon.
Yep.
You talk about price elasticity, the egregious drug profits and lifestyle. And I think, you hit a little bit on lifestyle as well, but maybe
Well,
you
let's
can
talk
share a
about
little.
the price elasticity. I
Yeah.
mentioned
Yep.
that because I get in front of CEOs and I love to, before I go meet with a group, wherever they are, I love to just look up a little bit of information. For example, I was in San Antonio, Texas recently, and I just did some very easy lookup to say, okay, there are two hospitals close together, both on that major insurance company in that area's network. And one of them can do a very common procedure called an ACL, which is a repair on the knee. And they do it for $7,000. And their outcomes reach a 5-star rating. Now, in that same community at a different hospital, there's a 3-star rated ACL repair that costs $70,000. And Aetna is willing to pay for either one. And they could care less which
And
one
they're
you go
not
to.
going to guide your members to the
Not
five
going to guide
star.
your members. So as long as you're just handing everybody the network, And
Yeah.
let's say the major healthcare system has bought up most of the funnel sources, and they're the ones who are providing the 70,000 ACL report, getting very terrible quality. They own the market because they bought up the referral sources. And
Yeah.
you're the one, it's your employees now. They're getting the 3-star rated ACL, and you're the one paying the $70,000. It's like, now that transparency is a law and a regulation and the law of the land across the country, and it's every single person's right to know the cost of healthcare before they get treatment, and because we now have quality outcome measures and the ability to rate doctors on their procedures, whether it's a surgery or any specialty, now we know what we've never known before. Think about it. When someone needs to go get a repair or needs to go get a major surgery, what do? They just, wherever my doctor tells me to go,
Hey,
right?
where did you go?
Or yeah, ask your friend, hey, did you have a hip replacement recently? How'd that work out? Who'd you go see? It's like, well, what if you could easily open the door, pull up the covers, and actually see the metrics that
Yeah.
doctors are held accountable to? I had a very good friend recently whose wife had to have a major shoulder surgery. And we got together, we opened up the box, we looked inside the quality, cost, appropriateness. I mean, it's one thing to look at quality outcomes, but what about did they even need the surgery in the
Yeah.
first place, right?
Yeah.
So we took maybe a few minutes, wasn't more than 30 minutes, where we simply looked at all the people who do shoulder surgeries that were close enough to him and his wife that he didn't have to go too far. He wanted to make sure it was within 30 minutes. And we just looked at all the ratings and we picked the number one doctor to get the best outcomes, had the best price, and got the best satisfaction. It was like it was all the same. The one did it all. He goes,
Hmm.
okay, that's what I'm going to call. His wife had the surgery. They could not be any happier with the outcome of their experience in every way, shape, or form with the way that provider took care of them. Now, imagine that that's the healthcare you're offering your employees.
Yeah.
That's the healthcare you want to offer your employees.
No pun, Darrell, but it's white glove.
It's concierge level. And I'll just take your cue. We offer, as a part of this new model, a front door that's even before you get to the primary care provider. It's customer service. And we call it white glove healthcare. And you can look us up at whiteglove.healthcare. And it's both a 24/7 customer service that's a concierge level of whatever you need. It also includes the nurse navigation to support people in going to when they need a surgery or all that information
How do
available
I choose? Where do I go? Yeah.
or doing that navigation. And then we also offer the coaching that partners up with your direct primary care subscription-based advanced primary care provider who's there to support you in reaching your dreams, goals, and aspirations, who's your personal representative to the health plan and is there to not just be there when you get sick, but is there to support you as a coach. We call them personal success coaches. We're here to help you reach your bucket list. So
Just,
at
that
White
makes
Glove,
my heart happy.
everything.
Yeah. Huge fan. There's nothing quite like a coaching model to help people really live their best lives. There's a lot of trickle down impact with that as well.
And you're
So,
not forced to do it. It's a choice that people get to make.
and then the challenge is you put this great plan, just knowing, I think for a lot of people that might, listen or watch, that just knowing that this kind of model exists, it's really taking off, it's growing. I think we're going to see more of it. Um, And also, but that once you put this in place, you regularly monitor it. You have, like you said earlier, you got to measure, is this delivering on what I said I wanted? And if I,
One of the things that I tell CEOs is they need to expect a dashboard. They need to define their goals, what's going to delight them. They need to measure to see if they're getting it. And they need a dashboard that tells them how well it's working. That's all they need to expect. Everything else, the alignment, the choice, the relationship, you don't have to worry about that. You just have to expect more and expect to watch a dashboard that tells you how well you're accomplishing your goals. That's not hard,
and if
CEOs.
it's not, ask why.
It's not hard.
What needs to change? Absolutely.
And one of the
And
things we do for CEOs is we kind of fit in there between the CEO and the rest of the ecosystem. We simply help CEOs build those kinds of dashboards, help them define what they want, and then build relationships with their HR, their benefits department, as well as their brokers to get what they want. That's our role, is to simply help CEOs realize how easy it is to expect more.
Yeah, and I think it's time. It's interesting. I was just talking with somebody about this recently, how, there's a paradigm out there that says, well, don't, if you really don't want to be disappointed in life, don't set any expectations. And with great love and respect, when I hear that, there's a part of my heart that just goes, oh,
Yeah.
because we miss out on so much. People generally rise to the level we expect them to. As consumers, we get what we expect because that's where we're going to invest our time, our energy, and our capital. And if we're not getting what we expect, we are going to take our business elsewhere, and it's going to be no different in healthcare. It's really going
Well,
to be a shift,
think about it. There's no other part of your life where that doesn't apply except for healthcare.
except
You
for
can't open
healthcare.
an app before they ask you, did you give me a Google rating? What's my Google stars? Oh, did I get a 5-star rating? What's my net promoter score? Would you refer me to a friend? It's like it's now this whole Deming principle of continuous quality improvement has permeated every industry except the largest industry in America.
I would
I,
say that's by design.
I often say it is by design. And I often say that the US healthcare system is the largest legal organized crime entity in the world. We kill more people and we steal more money than all the organized crime combined. And we get away with it because nobody's holding us accountable.
Just because we can. Yeah. Well, I have to tell you, Darrell, there's a whole lot of good people out here in our industry that are really working hard to make a change in this system. And I'm so glad to know you. What you're doing to spread that message and share with the real consumer of healthcare is really profound. And I'm ready. I'm cheering you on,
Thank
and
you.
I
Thank you for
appreciate
giving
you.
me your time. Yes, I
Yeah,
appreciate it.
well, thank you for sharing. If people have questions or they want to look you up and reach out to you, how can they best find you?
So the name of my company is Orient. Orriant. If you go to Orion or look up Orion, you'll come to my website. You'll see we've got lots of different services. White glove healthcare, we've got premier alignment, we've got coaching. But one of the things you'll find there is a link to this new model. And so there's a website that we link to that we've created called aspirationalhealthcare.com. And to learn about this new model, see what's going on across the country, even review the conferences that we've held, because all the videos, all the recordings are there. Learn about how this NUCA system works. It's a plethora of great content to explore and to learn more about this new model of healthcare.
So for a CEO who wants to have higher expectations, might be worth it to pop some corn tonight and watch some of those videos. Now, I also saw, is it Vistage? I'm going off of memory. Is it Vistage? You also offer an executive coaching program for folks as well,
So
right?
So Premier Alignment is my CEO coaching arm of my company. So it's called Premier Alignment. Vistage is the name of the world's leading CEO coaching organization.
Oh, okay.
So I've had the privilege of being the top speaker within Vistage for the last 12 years, talking to groups of CEOs who joined Vistage about how to control healthcare. And it was really my experience over the last 12 years is that I have to write a book. And when I discovered this best in class healthcare system, it was like my message is now simple. There is a major organization that has cracked the nut. You can expect more.
No,
All
I
you have
love that.
to do is hold people accountable.
Yep,
Define what
expect
you want,
more.
define what you want, measure to see if you're getting it, create a dashboard, and expect more. That's
Why
all
would
that
you pay for less?
exactly. Because
I
right
love
now
it.
they're buying really bad healthcare at a really bad price.
Right. Yep. Well, hopefully people who watch, they won't wait until, they're forced to take notice. Hopefully they'll act now and enjoy the profits that come from being ahead of that curve. Darrell, thank you so
Thank
much.
you,
Thanks for
Kimberly.
sharing the time. I can't wait to get my hard copy. I really enjoy the opportunity to do your pre-read and highly recommend getting your hands on Darrell Moon's book. It's going to come out on February 4th, so make sure you get a copy.
Just go to
And
Amazon and look up Make Healthcare Work for You. And starting February 4th, the book will be available in hard copy, soft cover, ebook, And soon after that, we'll have it available on Audible with the narration and all the platforms like Spotify. You can access it all kinds of places.
I love it. Well, I always have to get a hard copy because of, we are cousins. I'm going to want an autograph.
I'll send you one for sure. Okay, take care.